All right, it should be started.
Try that, Laura. We are not seeing it yet, but hold on.
It might take a little bit.
Okay.
I'm seeing it. It's live on the internet.
Got it.
Got it. Okay. All right. So I'm going to call the meeting. This is Jane Crocker, Baldwinville Road, Chair of the Board of Health. I'm going to call the meeting to order. We're just going to quickly review the minutes from February 24th, which Earl, did you get a chance to look at those?
Yes, I did. They're fine.
All right. No questions?
Nope.
Laura, any questions?
Nope.
All right. So one of you want to make a motion?
I will make a motion to accept the minutes.
Okay. So a motion by Laura
I'll
to
second
accept
it.
the minutes. Second, Earl, all in favor? Yes. Thank you. And we'll move on to the second agenda item, which is the COVID-19 numbers discussion. So there's been a lot of residents calling the Board of Health or getting in touch with Board of Health in regards to why we are not in Templeton giving the numbers.
Make sure you turn down the other computer. You're getting massive feedback. Turn down the computer.
Turn down my computer? Okay. Hold on. Is that better? Is that better, Mike? Now you don't hear me? Do you hear me?
There's a 30-second delay, so we won't
It's
really know
good.
yet.
It's good? Okay. If everybody else mutes themselves unless they're talking, that usually helps too. Okay, so we've been getting, the Board of Health, Lori's been getting a lot of people calling or sending her notes in regards to why we're not sharing the number of people in town who have COVID-19. And we're actually following what Governor Baker's and his administration said specifically, that we don't need to give the numbers in the town. They're releasing numbers by county, and we're leaving it up, or they're leaving it up to the discretion of the towns and whether they want to do it or not. We've chosen not to, partially because in my opinion would be that we have to assume that 100% of the people in town have it. That's how you have to react to this pandemic. We have to treat everybody as if they've got it and continue to use our universal precautions, protecting ourselves or them, other people, personal protection equipment to protect ourselves. Need to wash our hands, don't touch your face, practice social distancing, follow the stay-at-home advisory. Sadly, again, we need to consider that everybody's got this. You can't decide, does one person on my street have it, does another? If we start releasing information on who in town, not by names, but numbers, that might stigmatize people, and then it's gonna make it worse, I think. So I prefer that we continue to follow the instructions that Governor Baker has set forth. I know on the website we have information, the town has information, which links to the state information, which links to the county information. I think that's enough. And I've been watching the Wynn Brown from Haywood Healthcare every morning. There's a lot of great information there. Perhaps we could add that to the website. I don't know what else to say. Does anybody have any questions? Okay. We're waiting to see if anybody has any on. Are you seeing any, Mike?
It's because you don't.
Yeah.
Not yet.
Okay.
Just
I know
trying
it's
to
delayed.
find out how many are actually, sometimes you can actually see how many are actually viewing. I can tell you from a public information officer perspective and watching social media and again, being very closely tied with Lori's office. there's been a lot of interest in this. So I'd be surprised if people are not watching this live stream. I can at least see one person, I believe it's Bob May, is just hopped on the chat.
I think so, yeah.
Yep. And he is a frequent flyer for our live streams, so I automatically recognize his account name. That's not always the case with YouTube.
Right.
Yeah, Bob, you're joining at a very good time because they just had the debate, or not the debate. I'm sorry. Jane went through her position.
I can repeat that if you want me to. Probably won't sound exactly the same, but we've talked about it with the Board of Health, and in my opinion, I'd like to follow Governor Baker's and his administration by not releasing town-specific data for many reasons. Mostly just that people need to assume that 100% of the people have it, using their universal precautions and personal protective equipment. We can't think that nobody's got it. Okay, I see that you would like to see the numbers reported. I think on the in regards to that, Mr. May, if we report Templeton, I kind of feel we'd have to report every neighboring town, because we can't get what we need in town to survive. We have to leave town to get food. So the Wynn Brown on the Henry Haywood Healthcare gives a great update every day of the area, and that's where we'd have to go if we needed to have a test done or to see if we had it. So I think that that's a way to get that information, but I don't think we need to give specifics in town. I think it would create stigma.
Jane, if I may.
Yep, please.
I have spoken to several people, and I think that their point of view is that we don't want people to become complacent and think that there's not an issue because we're not reporting numbers. People also want to have some kind of comfort in comparing numbers with other cities and towns. And I'm just relaying the information, really. So, I mean, I do understand what they're looking for. And in my opinion, if we were to do something, it would really be a straight up number. We're never going to report neighborhoods. We're never going to report, you know, specific breakdowns. We don't do that with any other communicable diseases, and nor would we. But just like I said, after speaking with several people, they're looking to not be complacent. They're looking for security in numbers, and I'm sure that Bob can expound on that more.
Okay, I'm just reading the news feed. Lisa had said thank you. Sorry, they're all coming in.
Yep, just like every other public forum we have, we just need to make sure that that we establish who is asking the question and if they're a Templeton resident. There is a member of the news media on there, and she's appropriately identified herself, so I thank her for that. But we have, it looks like two citizens once Lisa identified herself.
Very quiet.
Is Lisa from the Telegram? Sorry.
No, Kim is from the Telegram. Kim Ring from the Telegram and Gazette. And then we have Bob May, identified as BM 36729. And then also Lisa S, who has asked us questions through the live stream before, but I just don't recall if she identified as a resident.
Okay, Lisa, could you just tell us who you are, please, and what street? What street do you live on? Are you from town?
I would recommend that she doesn't give out her street address. I wouldn't want her to give out her personal identifying information.
Oh, okay.
I think it would be sufficient if she said that whether she was a Templeton resident or not.
Are you a Templeton resident? All right, she said she's not media. Deborah Wilder is on the phone. Are you Templeton
Yeah.
resident, Deborah?
And Jane,
Debbie?
just a point of clarification. We've actually done a very good job of trying to, the continuity of government, having these meetings. We use Zoom, but it's the same as if you were in the conference room in Templeton, and it's important for people to understand that. So if someone says they're a concerned citizen, that's fine. You just won't be addressed the same way. Imagine if you came to the table and didn't identify yourself in town hall. That would be a problem. People aren't going to understand that using all these social media platforms, but that is the case. This is a public meeting. It was posted last week. Yep, Deb Wilder, we know who you are. You know, Lisa asked me to say, well, BM 36729 didn't identify himself, but we know that it's Bob May, and I think he actually said it right up at the top.
He did.
Yes, he
And
did.
so it's not enough to say it's a concerned citizen. You at least have to identify yourself by name and that you're a Templeton resident. One difference from being in person is normally you say what your address is, just like at town meeting. That is not to be difficult. That is to make sure that we're preserving open meeting law as much as we can with the Zoom platform. Thank you. That's a good point, Lisa S. They did identify themselves as the media, and we can confirm that. But as the public information officer for the incident command in Templeton, I'm well aware. I'm well aware of all of the press that have been. The press get to come in as well and ask questions from a media perspective. If you live in town, it's not bad to identify yourself. But I'm not going to hijack the meeting to do that. I just wanted to make sure that we were following.
Okay, so there was a question. Hold on. Nursing home. Okay, so that's how we would flatten the curve. Again, the same as what I said before, that we have to remember to use all the advisories that we have: stay-at-home advisory, personal protective equipment, wash your hands, cough into your elbows, practice social distancing. If you're not an essential worker, then you need to stay home. That's what we have to do to flatten the curve. And we have to assume, again, that 100% of the people have this virus.
Call from. Call from. Actual.
Jane, is it possible that people are looking for the numbers so that they can see if the curve is flattening with Templeton?
Is that what you said?
You were muted for a moment there.
Oh.
The phone.
I'm not muted. Is it possible for us to see that number? Is that what you asked?
Is it possible that they're asking if the numbers that we present for Templeton would show them when the curve is flattening?
You know, I listened to the governor this at 1 o'clock, and he said the numbers are going to be like 10 days off. That even though they feel they're flattening in New York, the data is not really there. And Michael had said it earlier that that's at the end that we really get all that information, the recovery. I don't know if it would be accurate. I think giving the information that we're getting right now is about as accurate as it's gonna get right at this period in time. Does anybody else have anything?
Yeah, I'm just sorting on that. One of the first questions, this is a question from the media, Kim Ring, who I did verify. She is with the Telegram and Gazette. She asked the question,
Okay.
she asked the question, is it possible to say whether there have been deaths at the nursing home? We have been getting calls from folks who are concerned about nursing home statistics.
Lori can answer that.
I haven't received any information with regard to deaths at Baldwinville Nursing Home yet.
Okay,
Okay,
I've got a question from Glenn Eaton of Templeton, and he's also the Executive Director, Montechusett Regional Planning Commission, and edict member. Stand by, I just got to switch windows first. It says, Lori, I just emailed you what the MPRC GIS service offered to the health agents boards is. I would ask you via or through you to relay this information to the meeting participants. If George has done that and it has something that you have on your computer, if you want to project that, we can do that. But I just ask Lori first to review it. But it looks like Glenn wants to share a resource that he thinks might be good for the group. In the meantime, I have Brian Curcio, a resident of Templeton. Okay, question from Brian is, I am a Templeton resident. I am an essential worker. Having these statistics put out to the public can help know what my risk factor is every day when I leave my house. So that
Okay,
would be an
again,
argument for.
I understand that, but again, you have to assume that 100% of the people have it. You can't take any steps down until we're told by the state, I believe, or the federal government that we can. You have to continue to use your personal protective equipment and universal precautions every day. I mean, as a healthcare provider myself, we have to treat every patient the same. We have to wear our PPE all the time. If we double glove for one, we have to double glove for two. We're in a state of emergency. We need to use the advice that we've been given by the authorities. Stay at home if we can. I mean, we have people in our family who are essential workers as well, have to go out every day. They've got to protect themselves just like we do in any environment, 100% of the time, like everybody's got the disease, sadly. So I'm not sure that those numbers would make any difference.
So Brian has a follow-up question, and he has disclosed in the chat that his family has immune compromised concerns, and he says that Dr. Fauci has said the curve will happen at different times in different locations. As a follow-up question.
That's what they said, but Governor Baker said the same thing.
Mike, I actually forwarded the information to you that Glenn Eaton had sent, if you'd like to take a peek at it.
Oh, someone requested, my last name is Crocker. I'm the chair of the Board of Health. Thank you, we can see that.
Jane, if it's helpful, I can read that out loud if you like.
Sure. Thank you.
Okay, this is from, again, this is from Glenn Eaton, the Executive Director, MRPC, sorry. It says, for your edification for the Board of Health, and it is just a Board of Health meeting today. On April 3rd, the Governor, Charlie Baker, and Lieutenant Governor Karen Polito administration announced that it would initiate a COVID-19 community tracing collaborative to further mitigate the spread of the virus. The program was said to be operational by the end of April. Inspired by the administration's announcement on April 6th, MRPC's executive director offered the MRPC's Geographic Information System, or GIS, assets to the Montechusett Public Health Network. Specifically, the GIS staff will provide COVID-19 case data to the network's health agents so that local officials in the medical community will be able to track the disease as it spreads through the population at the municipal level. Details for this service are being completed by Stephen Curry, no relation, Health Director, City of Fitchburg, and Jason Stanton, MRPC's GIS and IT Director. No personal information will be published by the MRPC. Therefore, there will be no violation of the Federal Health Insurance Portability and Accountability Act, also known as HIPAA Act of 1966. MRPC's District Local Technical Assistance, or DLTA, and Local Technical Assistance, or LTA, funds will be utilized to deliver the critically important data to the network, which includes 13 cities and towns in the Montechusett region.
Thank you.
Thank you, Glenn.
There was also a question. Oh, go ahead, Lori.
I just said thank you, Glenn.
Okay. There was also a question earlier that was given to us in email asking as far as the legal aspect of it as to why we don't, but that goes right to the Department of Public Health and they're releasing counties. And it's up to the discretion of the city or town if they want to release more information that's town specific. And we got that information from Cheryl Sparra, who's the Mass Association Board of Health Senior Staff Attorney.
On the question of legality, I've been working with the Board of Health as the public information officer to make sure that the public is also aware of what statutes govern these situations. Lori, if within that email to the citizen that I responded to today, I gave that list of it, would it be helpful if I pasted that list of laws and regulations into the chat area?
If you'd
Yes.
like, yes, please.
See what?
Okay, so are you seeing Brian Curcio's statements / question or discussion item? I think that's a fair statement, as I've been at least out once, if not twice, and seen what Brian has, if you'd like to address that. So Brian asked, maybe if you get us statistics, people will take this more seriously. I see people in town every day not using masks or anything, which is putting my family at risk.
My understanding is if you're using social distancing, you don't have to have a mask on. It's when you go out into public places. Am I wrong on that, Lori?
No, you are correct.
Okay.
I feel that way as well, yes. Thank
There's a
you.
question asking if other boards members feel the same way. Earl, do you have an opinion on that? You have to unmute yourself, I think.
I believe the social distancing. I think that if we start giving out numbers, there might be, it can go either way. There could be a false sense of security or a panic. I would just go with the governor's advice. I mean, if we're doing better than the curve, we're flattening the curve. If we stop and get complacent, then we could possibly go the other direction. So just, I think, leave it well enough alone. I do agree that social distancing and wearing a mask and all that other stuff, it seems to be working. And if people continue to do it and follow the rules, hopefully this will end sooner than later. But that's just my opinion.
Thank you.
Would it be all right if I clarified a couple things?
Sure.
Yes.
Okay. So even though at this time we're not reporting numbers, there are definitely, as Mike said, we did report at the very onset previous to the governor asking us not to, and Mass DPH asking us not to. There are confirmed COVID cases. There are recoveries. There are, the typical reports. I can report that we have no information on anybody in the postal system delivering mail while being infected. We have 0 reports on that. And if for some reason there was contact, you would get called from one of our public health nurses through the trace contact information.
Okay, there's a question. If residents ask about what's happening in their town, direct them to the municipality's website and look for coronavirus or COVID-19 alerts. Also, have them visit their Board of Health and or health department. Don't visit them, call them. Exactly, that's what you need to do. And then there's another one, when you're getting gas, the cashiers aren't wearing masks. I did hear today that perhaps they're gonna start fining people if they're not. I mean, can we do that in town? I don't know. You can certainly call the Board of Health and tell them that someone at a grocery store isn't wearing a mask. I mean, I carry sanitizer around with me in my car. Whatever I'm doing, whether it's pumping gas or going to a grocery store, I wash before, after, clean the cart off. Most of the stores, I know Market Basket has been they have someone in charge cleaning the baskets off. And they're counting people who go in and out now to try to keep that curve down as well. And yes, the advice was for everyone to wear masks when they're in a public place. I don't see any other questions. from residents. Does anybody have anything else they'd like to share? Oh, wait. Yeah, elections are coming up. I don't know how those are going to be handled. I believe there's something in the works at a state level or federal level. I don't know.
Jane, I think it was, Mr. May can correct me if I'm wrong. I don't think it was meant to ask you when the elections are going to happen, but basically, thanks for not releasing the data.
Oh, okay.
That's the way I took that.
Okay. And yes, it is, Lori, is it part of the Board of Health that if somebody reports someone is not wearing a mask, we can certainly speak to them, correct?
Correct.
So
Do we
I
have
would make a,
information-
Oh.
Excuse me. Do we have information on the town website regarding masks and the cleaning of them and whatnot? If we don't, would that be helpful for some residents? As in, if you're wearing a mask, that's great, but if you're using the same one for 3 weeks straight, I don't think you're really doing anything. Or you're, wearing the same gloves, for example, and you're touching a bunch of stuff, these things are intended for one use, most of them, unless you've got the ones that are cleanable. So there should be I think we should maybe reinforce that with the public so they don't get that I'm wearing a mask, I'm safe thing in their head.
that's a great idea, Earl.
Just a suggestion.
That could go up there, correct, Lori?
We can make that happen.
Okay. Also too, with gloves, Earl said it quietly, but you put on a pair of gloves, as soon as you touch them, anything, those gloves are contaminated. You really need to keep with the sanitizer. Don't give yourself a false sense of security wearing gloves. If you're touching anything, whether it's a carriage, gas station pump, your face, if you touch something and touch your face, they're contaminated by whatever you touch.
I've also heard that if where pumping gas is concerned, if you're using a plastic grocery bag, one-time use to handle the pump, a lot of people have resorted to that. They don't have access to gloves. And using a Q-tip to put in your PIN number so you're not touching the actual keypad. There's some small tips like that out there. People can feel free to add what they wish, but those are just things I've heard of people doing, and again, when you're done with it, put it in the proper receptacle. Don't just drop it on the ground.
Yes, and that I've seen a lot of that dropping on the ground. And as far as someone made a comment here that is it the resident's responsibility to report somebody? If you see a business that isn't following the protocol, yes, you should be calling the Board of Health so that the Board of Health can talk to them. We're staying at home. We're not supposed to be driving around looking to see if somebody's violating it.
Jane, do you mind if I jump in on that point?
Please do, Mike. Thank you.
So part of, we're talking about Cumberland Farms or we're talking about any kind of fuel filling station, but restaurants affected by this can't have any congregation inside. And there is a surveillance of what's going on out there. People are going to restaurants and everything. I know that Lori has spoke to many of the restaurants to make sure that they are practicing safe guidelines, making sure people are waiting outside, that they have a procedure in town. TCTV, I think it was about a week ago, had a an excellent YouTube video of all the different food establishments in town. So when we say that we're not out there, not ensuring compliance, we absolutely are, because our surveillance system is also our residents who report back. They didn't feel safe. I think, Mr. Curcio, I think that's what you were saying, is it's a matter of feeling safe and making sure everybody's, at least businesses, are providing a safe place to get gas, conduct business, get food. And I can tell you from personal experience working with Lori, that is definitely occurring. Everyone that's on this chat, whether you're a citizen or not, not a citizen, I'm sorry, a resident within Templeton, you're all performing some kind of surveillance right now. It's not like the board does not hear what you're saying. The board is made up of people that are very aware of what the public health concerns are. They're not dismissing, from my perspective, and this is an opinion, they're not dismissing what you're saying. Not at all. They're taking everything that you have to say and they're working on that. A moment ago, they said, we basically, coming out of this meeting, we're going to have better guidance on how to re-clean or making sure that you're sanitizing your masks properly. This public discourse is very helpful to the board.
It is, thank you. And I know I've been to gotten takeout in town and they were wearing masks inside, which is great to see. And yes, somebody said, see something, say something. Definitely, please do. Let us know. And give Lori a call at the Board of Health.
For anybody who's listening, the Board of Health phone number is 978-894-2771. Even if you call on the weekend, I get the text image of the phone call or the message on my phone at home.
So I would like to make a motion that we continue
I'm
to.
sorry, could I interrupt?
Go
There's,
ahead.
we had two
Yep.
more questions. One of them is definitely a rehash of what you had gone through earlier. Jeff Bennett asked a question on the website where people are directed to look for coronavirus information. They see the DPH advisory, it leaves it up to cities and towns to release numbers or not. I'm not sure if he was in the beginning, but again, to your point of the local decision, if you want to speak to all at that, and then there is another follow-up question on after.
So yes, the Templeton ma.gov site gives the links to the state site, which gives a county breakdown. We also suggested that we put up, it was suggested by Earl that we put up mask safety, gloves, information about gloves for myself. And it would possibly be helpful to put in the Haywood Healthcare President and CEO Winfield Brown's update every day, if we could possibly put a link to that.
Jane, another question, this one, Steve Castle, as a concerned citizen, wanted to ask a question. Do people have a right to know?
A right to know what? Sorry. Oh, okay, I see the question. People have a right to know. I believe that you're right on that, but we have to assume that everybody, 100% of the people are infected, that we can't, again, lessen the precautions that we take in personal protective equipment and universal precautions. We have to continue to do what the governor is advising us to do. Is there a need for us to know if the person next door has COVID? We have to assume that they all do. So what is the difference going to make is my question. Okay. And others are saying that they'd like the information to release. Lori, how difficult would it be for you to release that information accurately? And how accurate would it be, I guess, would be the question.
It would be accurate, but it would be probably at least a day behind.
Okay. Can I just ask, how many phone calls or inquiries are you getting per day?
Oh, gosh. Most of the inquiries I get come during the weekend. I'm not sure why, but it's usually several inquiries. During
Okay.
the week, it's pretty quiet.
Okay. I guess I would ask, why on the weekend do they not really want to talk to anybody? They just want it. Sorry, I'm reading other questions, sorry. Okay,
Jane, as far as speaking to live people, not messages and not texts and not emails, I've probably spoken to maybe half a dozen people live.
okay. Okay.
There was a
People are
question
saying that they
from,
have. Oh. Go ahead.
yeah, Jane, you're gonna get a lot of comments that are basically either comments or questions. What I'll try and do is, I mean, you're seeing them, so we're both putting our eyes on it. But if
Yeah.
if a new question comes out, I'll definitely, I'll make sure that I frame it as a new
Okay.
question. But you have a lot of people that are coming on, basically piling on the same question. It's your choice whether you address every time someone brings it up, or we can kind of circle back if it has it. But much of that's what's going to happen, is that you're having comments that basically pile on to one of the other questions. So I'll help you with that. But there is a few
Thank you.
comments about rights or otherwise. And there is a question from, I believe at least we had one member of the press on there. Again, it's Kim Ring from the Telegram and Gazette. She asked a question specific about Allied Health. I asked her for the link because I don't have that information. I wouldn't want to answer it unless we had where that's coming from. Otherwise, it's just speculation that occurred. So I've asked her to post the link there.
Okay.
Unless you have data on that you'd want to ask. She asked the question about a death at it's a reported obituary death from that facility, and I don't have the information on that.
Okay. Do you, Lori?
I don't have
From
that
Baldwinville Nursing
information.
Home? Okay.
Just two comments more. Another comment on the right to know the numbers, and then Jeff Bennett brings up releasing numbers if low convince people that the stay at home and other things are working. Any feelings on that perspective?
That's my concern. If we release numbers and they're low, then people are going to get that false sense of security again, and they're going to say, all right, we can lay off a little bit of wearing the PPE and using the universal precautions. I'm not seeing any new comments at this time. I would like to make a motion that we continue as we've been doing and that we add the Win Brown link to our website as well as the gloves and masks. And that will give people information for the area, which is, I think, would be more effective than just the town, because we all have to travel out of town in order to provide for our families. Any other comments? One second. Earl,
No,
thoughts?
I mean, I would second it. I agree.
That's Laura.
I'm
Hope.
also, with it. Yeah, I agree.
Did you get that, Lori?
I did.
Okay. All right. And thank you to all the people who participated in that. Oh, Lori, could you state the Board of Health number again, please?
978
And Michael, if you could type it in. 978
894
894
2771.
2771.
Jane, you had a motion and a second. Are you still accepting questions?
I'm reading this, sorry.
It's okay.
I think that we are being transparent and giving the information that we give. Someone's asking about that. We're not hiding anything from anybody. We just have to assume that everybody's got it. I'd hate to see that we have a stigma attached to anybody or anyone in town because of this. So if that motion has been seconded, do we want to all in favor to continue to do what we're doing, adding the other information as well? And I would like to add that unfortunately, so many people fear is bringing, it's dangerous and they feel it causes a threat. It's very unpleasant emotion. In order to overcome the fear, we have to let ourselves act differently towards others. We have to assume that 100% of the citizens are infected and to continue to use the PPE and universal precautions. Knowing how many people in town have this is not going to change anything. We have to continue to do what we're doing and be diligent about it.
Agreed.
Definitely agreed.
Thank you. So all in favor of that motion?
Aye.
Aye.
Okay, thank you. Thank you for everybody who participated in this thus far. Mike, are you understanding? I'm not understanding about election time. About going to the polls, is that, I'm not sure what is being said on that.
Jane, your board is elected.
Okay, that's.
Yeah, I think it was
So-
the insinuation that if people do not like the way that you're making decisions, that elections.
Okay,
Yeah.
just making sure I was getting that right. Thank you. If anybody's in need of personal protective equipment, I can certainly supply some for them, or I'm sure that the town has some, I believe, Lori, the board.
We do have some in our office. If somebody calls and has inquiries into something that they need, we can take that into consideration.
Okay. Thank you. So we'll move along on our agenda. Patriots Road Community Septic, Laura, did you have something to say about that, Lori?
947 Patriots Road is a condominium of 4 units. They have to replace their septic system. They are asking and have applied for the community septic loan. I don't see any issue with it. It's for a total of $29,200 to be divided evenly amongst the 4 units. And I just need a vote to approve it.
Okay. I would say that's good. I would vote to approve that.
Second.
Third.
Thank you. And the Templeton Fish and Game.
I just wanted to update you on Templeton Fish and Game. That is summer residences for a lot of people. Peaceful Pines is also one. There are no orders from the governor's office prohibiting them from going. However, I do believe we should follow suit, and anybody who's moving into their summer residence should self-quarantine for 14 days.
I would agree with that.
I'll be composing a letter that I will give to you for review prior to it going out. I'll be contacting the owners of both properties just to talk to them about it prior to sending the letter. And if you have anything to add, I'll probably be working on it tomorrow.
Okay, thank you. Any other concerns before we adjourn? Okay, then I would make a motion that we adjourn. It is 5 o'clock at my house.
Second it.
Thank you,
Third.
Earl. Okay, thank you. The Board of Health meeting is